Hey guys, it's Dr. Swathi Leroy-Kuhn, vascular neurologist, and as we're heading into the month of May, I want to talk a little bit more about stroke. In my first video, I talked about some basic facts regarding what a stroke is and why it's important to seek medical care immediately. And one question I automatically thought of that some people may ask that I want to talk about now in the second video is waking up with stroke symptoms and why it's still important to come in right away. I can see, and I come across it daily on my practice, that patients may wake up with stroke symptoms and then they kind of wait around to see if it'll go away. And, I think the natural thought process is, well, hey, Dr. Leroy said, if I come in within 4.5 hours, then there's treatment. But if I don't, then so why would I come in? And that's not it at all, because actually some trials have shown that if you do come in, even right when you wake up, you can be a candidate to get an MRI immediately. Sometimes we can't. Some centers don't have MRIs, but some do. And if an MRI machine is available, sometimes we'll be able to get an MRI immediately. And on the MRI machine, when we get the images of your brain, there's like different types of imaging. And so if we see certain qualities on some of the images, some of the series, and compare it to the other series or the other types of images, all of your brain, we can try to localize when that stroke probably occurred and whether it's actually safe to still give you the clot busting drug. And that's why it's still so important. Even if you wake up with symptoms, go to the ER right away. Don't try to drive yourself. Call 911. Please come in. Don't delay. We can still try to help you. Moreover, if we find that we can't get the MRI, but we see a large clot, sometimes we're still able to take patients to get a procedure performed called a thrombectomy. A very, very fancy word you don't have to worry about. It just basically means we're going to take that clot out of your brain. We're not going to do open brain surgery. It's actually a very minimally invasive procedure. And I'm telling you, for some of my patients, it's made the difference between being bedridden and being able to walk again. So super important. Please, even if you wake up with stroke symptoms, please go to the ER right away. There's still different ways we can treat you. Thank you.